The highest honor awarded by the South Carolina Athletic Trainers Association is the Fred W. Hoover Award of Excellence. This award honors members that have given unselfishly to the association and its membership for many years.
How many years have you been in athletic training?
This will be started in joined the NATA in 1952.
Gotcha.
So let's see, you figure that up, that's 60 something years.
Yeah, great. That's awesome. All right. And out of those years, what would you say your favorite clinical site to work at was?
Well, I've only worked at one. Well, I worked at two.
Okay.
I worked in college. I've only been in the college profession.
Okay.
I started at Florida State and was hired my senior year. At that time, there's not many trainers in the country, about 300 people in athletic training. So I started in my senior year. The athletic director had me extend my graduation and hired me as head trainer. Okay. So that was in about 52. So I worked at Florida State, worked there and had to go called into the Air Force ROTC and returned to Florida State and stayed a couple of years and then came to Clemson in 1959. So my entire college, I've only been at one school really full time since 1959.
Gotcha.
So I've never been in any other thing but the college setting.
Okay. And since being at Clemson, what sports have you worked at?
What schools?
What sports?
Oh, I worked all sports.
All
of them? I was mainly with Clemson football.
Okay.
But I was at that time we had you were hired. You were trainer, then head trainer.
Okay.
The word head trainer was used instead of director of sports medicine.
Okay.
But I was actually the head trainer and responsible for all sports, but primarily I was football.
Okay. So you said that they extended your position when you were at Florida State. So what was your undergrad degree in?
Physical education.
Okay.
I had at that time, I started out and when I entered college, I wanted to be a coach.
Okay.
But I got into when we got to the Florida State at that time had just become a men's school. I don't know if you knew that, but in 1948, it was all women.
Okay.
And they made the University of Florida all was male, so they made them both co-ed. So we're just starting football really. So we had the veterans coming in from World War II. Were coming back then, and they had a program that started and had a graduate assistant trainer from the University of Indiana. And I was a manager, and he kind of started talking to me about learning the tape. And at that time, the word student trainer was not really, had not formulated yet.
Right.
But anyway, that's where it started. And then I became more, my courses that I took was selected with my advisor. I took a lot of anatomy, physiology. I took nutrition course. I took physiology and physiology of exercise. And I took the courses I thought could help me in treating injuries.
Yeah.
But it was a self type thing. It was not a curriculum.
Right. Perfect. Great answer. So you talked a little bit about the person from the University of Indiana. He can be the answer for this question too, but who influenced you during the early years of your career?
What do you mean? I don't understand.
Just like in athletic training, were there certain athletic trainers who influenced you or like?
I got you. I understand. Well, at that time, as I said, you would go to a trainers convention or symposium as we have, yes. And they was held in a hotel, and everything could be held in one hotel because the first one I went to was only 300 people there.
Yeah.
Then you got to meet some of the old timers, the trainers that in the country that you just had to listen to them. Now our communication was with Kramer. I'm not sure you're familiar with this, but Kramer had a first aider.
Okay.
Is what it was, a publication that came out, and that was they really were pioneers in the publications of and promoting of athletic training.
Okay.
So you would read the articles that were written in the Kramer. Then Bike came out with one, and then books were being written then. But Ken Rawlinson at the University of Oklahoma was pretty big. He had a lot of influence on people, and the the way we learned was to go to sports. We didn't have such thing as we have today as sports medicine meetings,
Yeah.
but they would have doctors were beginning to hold clinics and having lectures on knees and shoulders, and more or less going into sports injuries is what they called it.
Right.
And you would attend as many of those in the summer in any clinic or symposium you could go to, and that's the way but as far as the trainers, Eddie Quest was the trainer from Indiana, and he started me, but Sam Langford, it was at the University of Florida, people of that type that were the only trainers available that we could talk to. Now, then we got into later years when Dr. Jack Houston started the Houston Clinic. He promoted sports medicine, and that he and Dr. Andrews, that developed into American Orthopedic Society for Sports Medicine.
Yes. Gotcha. So you already talked about what made you get into athletic training and the beginning stuff like that. What were like the hot topics of athletic training when you first started, if you could remember?
Well, there's a couple of them that were real popular. With heat illness was one of the first, because of 1950. I'm quoting you dates that are approximate anyway. 58. Okay. There's a lot of deaths because of heat problems, and when I say heat problems, the deaths were not only from heat illness, but coming from related, maybe a kidney problem from this type of thing. But we started in a lot of research was going on into the heat illness and the causes of it, and how we had to start taking breaks and trying to be more. See, in the old days, a lot of coaches didn't believe in water.
Yes.
They thought water was a no.
Yes.
That would cut the time anyway. But we had to get into that one, and the other one was fitting of equipment.
Okay.
And research and development of safety equipment, and one of the primarily ones was the helmet. And then they developed the face mask.
Yes.
And they started developing that. Then they started working with the shoulder pads. Instead of just handing the athlete a pair of pads, they started fitting and developing process for fitting and doing it properly. And those were topics. And then we got into one of the early was rehab. That was a subject that was not really. After the surgeries were getting better, the doctors and sports medicine were developing more techniques and knee surgery, shoulder surgeries, and this type of thing. But then we started with the development and progress in the field of rehabilitation.
Yeah, that's awesome. All those things are obviously still very prevalent now in our profession. So that's exactly
right. And
to see how long stuff has been going on and how it's changed over time.
You used to, as you well probably in your studies, you have a meniscus injury, and you put a cast on it. They would operate to remove the cartilage, and then put a cast on it for 3 or 4 weeks.
Yeah.
As well, now our rehab is taking run and medial collateral surgery was 6 to 8 weeks in a plaster cast.
Right.
And then you'd have the triad injuries that would come up, that would have all three would be season ending. It would be the career ending injuries, because it didn't have the knowledge we have of the ACL knowledge and the things of the rehab we do today.
Right. That's awesome. So what would you say your favorite joint is to work on?
Favorite?
Favorite
Mm,
joint?
I don't know. That'd be a hard one. Oh, I mean, I like them all,
Omal, that's a good answer.
but the that's like favorite coaches. It's hard
Hard to
to
pick
come up,
this one.
it's
What
hard
would
to
you say
pinpoint.
is the most troubling or can be aggravating to work on?
Well, when we go back to that, I would say head injuries.
Head injuries?
I mean, that was one of the most difficult, and head and neck injuries,
Yeah.
because we weren't real as today, and your studies that you're doing now, concussion, you're way above. You know what you're doing with protocols
Yeah.
and then the procedures that you're using today, and we didn't know that.
Yeah.
A doctor may would be on the sideline with you, but a player would come off the field. He could answer a few questions and ask him his girlfriend's name or his, things, questions. He answered them real quickly. The doctor used that, and then they'd check his eyes, make him sit down maybe for a quarter, check him again, and then maybe let him go back and play.
Right.
But I mean, that's the serious one, went straight to the hospital.
Yeah.
But another thing that we had, we learned how to transport injuries. Now the neck, especially the
Yeah.
neck and head injury, how to put them on the boards and how to transport them and get them to the proper medical facility, as well as uh, using stretchers more often, or wheelchair, the rolling chairs and things to move the athlete. And that was some of the problem, was just making sure. And another thing is, you have to answer your question is return to play.
Yeah.
That was we had to have which we have guidelines now and protocols. We didn't have all the protocols. My later years,
Right.
I had books of protocols, but first we didn't. We just kind of played it by not by ear, but just by procedure. Just
Yeah.
and but the biggest thing is a research and development in sports medicine.
Yes.
And another field that we were ignorant in was nutrition.
Yeah.
And we didn't know. I mean, back in the old days, you'd eat steak on Friday night, a 12-ounce steak on Friday night, a baked potato, salad, maybe Jello. And some of the coaches at that time would even not want ice in the water
Right.
because they felt like that was I guess it goes back to whatever their coach did is the way that worked.
Yeah.
Then, but but the things that along the lines like that would be, uh, it's way but research is sports medicine and schools and the curriculums and the teaching and it's just unbelievable
Yeah.
of how they to make it. And then we have sports psychiatrists, we have nutritionists, we have the whole works that
Yeah.
working with us, and we have equipment men that have they're educated and developed. They have to pass certification tests the same as we do.
Yes. Yeah. That's great. I'm sure my professors would agree with all the research. It's very important. This may be a tricky question, but do you have one experience that still stands out to you to this day?
Not, I guess one was a complete dislocation of a knee. That would, for one thing, it's always has stayed with me.
Yeah.
But I don't know of any other that so and heat illness.
Okay.
And seeing some cases of heat exhaustion, of true heat exhaustion, where you had to pack that person in ice and get him to the medical facility, and you were helpless really, but just to you could only carry it so far, and then you had to turn it over to. But those are the type things I remember most.
Do you
But
think
one of the best things, if you always remember, is the plus side of it is seeing that athlete return to play.
Yeah. Yeah. Do you think that they stick out to you because they were like scary experiences, or do you feel like you were comfortable because you knew that you knew how to treat the person? It was just something crazy that happened, so you remember it.
Just I don't remember,
Yeah.
but it just happened.
Yeah. Do you think
But
that you felt prepared in those moments?
oh yeah, you were always trying to be ready for, for as you're being taught, you got to be ready for any situation,
Yes.
and you have to keep reviewing and keep. I guess the best thing is going to the symposiums like we go to now,
Yes.
and sit and listen to lectures, go in and it's more of whether you're going, you don't think you know it, but you go as a review
Right.
and review techniques and review what would I do in this situation,
Yeah.
what and be prepared for it. That's like heat exhaustion. We used to tell coaches you can't go out to the 7-Eleven and buy a bag of ice and bring it back to the practice field.
Right.
That ice has to be in that bucket ready to put on that athlete and
Yes.
be prepared, and to have a procedure set in a protocol that in case that heat illness, what do I do? Where do I go? Who do I call?
Right.
And the number of schools that have no ambulances have no, they find sheriff's department that would help them, or someone that would go back and try to find someone that would help them in an isolated rural setting.
Right. So my next question might kind of go off your previous answer, but what advice would you give to today's young professionals going into a new job or going into the
What
setting for the first time?
you mean? What would I give advice a person going into athletic training?
Yep.
Oh, well, I think it's a great profession. I think it's a profession that you better be dedicated and expect to work long hours, unusual hours, and you're going to reach up the pleasures of it. You're seeing real good situations, and you're going to see bad situations. But I think that a person that wants to go into it should be uh, dedicated to the profession and dedicated to being open-minded and learning. You can't close your mind. You can't do that. You got to be open-minded and be ready to. And my theory through my years was that if I went to and was doing something and I saw where it could be done better, then I did it.
Right.
I was always open-minded to try to love new techniques, and listening to a person that they had something better than I was doing it, listen to them because it worked. They wouldn't be telling you about it.
Right. There's always
So,
room for improvement.
and I a little side thing I always tell people going into training. I said, now you got to be dedicated. You got to be go to many clinics as you can. Go to symposiums. You go to symposiums. Go sit in the lecture. You don't go sit in the lobby.
Right.
And but to a young person going to, one thing I regret is I worked, training was my hobby as my profession. And I'd say get a hobby along with that athletic training, with that. Play golf, play tennis, play jog, go do something that you, when you get later life, you have something to follow up and keep you to make it better. But make your plans at how long you're going to stay in it. I stayed in it probably too long, but I mean, I love what I was doing,
Right.
and I did, and we're just so happy to seeing so many young people going into athletic training,
Yeah.
and like yourself, and getting advanced degrees and advancing yourself, going on to master's and doctor's degrees. And there's so many different opportunities in training today other than industrial training.
Right.
And industry has hospitals, clinics. Well, you know all of the that's the type of people you're dealing with yourself.
Yeah.
And but be able to continue. I guess the best word to say, don't ever think you know it all.
Right.
That'd be the best way I could describe it.
Yeah.
because you're gonna find something today. Every day had a different,
Yes.
and that protocol on that ankle sprain, you look at one today and nothing's working.
Yes. Every
And
instance.
and don't get discouraged with that. Just say go back to plan A.
Yeah. That's great. All right. I have one last question for you.
All right.
So since you've been in the profession for quite a while, what do you think the next best step for the growth of athletic training is?
What is the next step?
Yep.
I That's hard to say, except it's going to be. I'm not sure that I really think the thing is going into a lot more research.
Yeah.
I think there's going to be more people, and the education part of it, that's going to have more time, more effort put into research and development of the profession.
Yeah.
And we're recognized by the of all the associations, and we're certified and licensed in most states. And I think I just think it's going to be development from research and seeing what's better,
Yeah.
and the athlete and what the body's being developed now. Another thing in older athletes than jogging and things, now doctors are learning, like myself, life expectancy used to be what 60s, and now it's 80s.
Right.
And getting keeping up with that body as those other 20 years.
Yeah.
But I think research development, and I think there's going to be more schools put into research and
Yeah.
for in training and treatment. And the field of sports medicine is just unbelievable. As you well know, take ACL injury, total knees, total ankles, total, how quickly you get back.
Right.
Now that, and because of the research that's been done and the knowledge of what's going on with it.
I think that's great. Research is definitely very important. Being clear, when you said that heat illness was a hot topic back when you first started, it's still a big topic now, and there's so much research about it, and it's always improving. So,
And we know so much more.
yeah.
And one thing that I encourage young trainers to do is, I was proud of the state of South Carolina. I've been involved in licensure of it since it started. I've been involved in the South Carolina Athletic Trainers Association since it started.
Yeah.
And the thing that's encouraging to me is seeing and promoting young trainers to be involved with the association. Get involved by serving on committees.
Yeah.
Get involved by being part of groups. And when you're asked to serve on a committee, serve on it. And give your opinions of that's why you're on the committee. But this state has been really good about our young trainers, about developing our association. We have a meeting, and you're probably aware of our state meeting is larger than our district meeting.
Yeah.
And it's because of the young people and the people that participate and the people that are guiding us.
Right. Well, this has been great, Fred. Thank you so much.